Welcome to the ClearlyWell podcast. I'm Elizabeth McKeon, a board-certified psychiatric mental health and addiction recovery nurse. This podcast aims to bridge the gap between mental health and substance use discussions, fostering understanding and empathy while reducing stigma. Join us as we amplify the voices of those with lived experiences, creating a non-judgmental space for their stories to be heard. Thank you for tuning in. Well, hello, this is Elizabeth McKeon with the ClearlyWell podcast. Welcome to today's short sesh. I am again having allergies, so if you hear that little bit of gruffness in my voice, that's definitely the leaves changing and falling and the high pollen content out there. So, hey guys, what about those Yankees last night with a 11-4 win over the Dodgers to keep the World Series going? I am for neither team. I don't have a quarter in this dollar, but I definitely like it that we have a game moving forward. So, little fun fact, just starting off the day with the fact that I put the ClearlyWell podcast into ChatGPT, and I was just sharing with Sean Clyde, our producer, this is what the ClearlyWell podcast from ChatGPT had to say about us, and I was pretty excited about it. It says, the ClearlyWell podcast addresses the intersection of mental health and substance use disorder by fostering conversations that destigmatize both areas, promoting a holistic view of wellness by featuring stories from individuals with lived experience and insights from professionals. The podcast highlights the interconnectedness nature of mental health and substance use, advocating for integrated treatment approaches. Through these discussions, the ClearlyWell podcast is challenging traditional views, raising awareness about the need for dual diagnosis treatment, and is working to break down the historical divide between mental health and substance use care. So, for me to have that generated in like less than a second told me that, first of all, ChatGPT had listened to my introductory podcast, which is basically what it repeated, but did it in such a way that also addressed the historical treatment approaches, which have definitely divided mental health and substance use disorder. So in today's short sesh, I do want to talk about why that was important to me to bring a podcast to you guys that is addressing the fact that there is definitely not a division in mental health and substance use disorder. Although they have historically been treated as separate issues, a divide rooted in differences in treatment models, stigma, and even healthcare policy. Historical treatment approaches have taken the mental health model versus the addiction model. Traditionally, mental health was treated using psychological and psychiatric models with a focus on therapy, medication for disorders like depression, anxiety, or schizophrenia. However, substance use disorder, on the other hand, was addressed through behavioral models, emphasizing on abstinence, behavioral change, frequently in settings that are very separate from the mental health care industry. Early stigma around addiction was treated in this fashion. It was viewed as a moral failing rather than a medical issue, leading to it being treated outside a traditional healthcare system, often in a private clinic isolated from other support. Stigma around substance use disorders are sometimes seen as self-inflicted, like they intended to just go out there and become a person with substance use disorder. This is leading to separate systems and different societal perceptions compared to mental health issues. This stigma still persists and often influences policy, research funding, and types of services that are available for substance use disorder. Mental health conditions are increasingly recognized as medical, while substance use disorder, especially illicit drug use, is now being frequently criminalized. This is leading to different pathways for care, with addiction treatment sometimes operating more like a correctional service rather than a healthcare service. And guys, I will tell you this is why there's so many grants out there. Like our company, our nonprofit works with funding that comes from, organizations like the DBHDD or SAMHSA. But honestly, this should be treated through insurance just like every other disease out there. There's different healthcare and funding systems for both. In the United States and other countries, funding for mental health and substance use treatment often comes from separate sources. Like Medicaid, Medicare, funding streams are different for each. This can lead to fragmented care, right? This separation in funding structures also makes it challenging to integrate treatment programs. This causes a complexity of co-occurring disorders. Diagnosing co-occurring mental health and substance use disorder can be complex, right? Because they're always separated. This has historically led to treat one first, then the other, like achieving sobriety before treating the depression. Co-occurring disorders or dual diagnosis require specialized integrated treatment that addresses both conditions simultaneously. And unfortunately, guys, this is why treatment programs that do address both at the same time are usually on a private pay. I mean, you have to go to like Malibu or Buckhead in Atlanta, somewhere like that to get like specialty treatment. But I will say, in the wrapping up today's short sesh, in recent years, there has been a growing recognition of the benefits of integrated treatment. As research is showing, mental health and substance use disorder are deeply interconnected, as we show on the podcast, and they offer simultaneous treatment. Integrated care models, including dual diagnosis programs, are becoming the standard. And even while right now that is more in a private pay setting, there's a lot of information coming out there in policy and legislation that is going to address mental health and substance use as interconnected issues rather than separate ones. So I'll wrap up today's short sesh on a positive note that yes, we are out there, people like myself and others are out there really lobbying for our legislation to understand that substance use disorder and mental health belong in one space, and we need to move toward integrated treatment. Thanks, guys. Talk soon. I want to state that please do not substitute this podcast for professional therapy or treatment. The content shared here is for informational and entertainment purposes only. We do ask our listeners to respect the diverse experiences of individuals and refrain from passing judgment. If you or someone you know needs professional help, please seek the guidance of a registered and qualified mental health professional. ClearlyWell is brought to you by Healthy Georgia and produced by CNC Media.